of a patient. Hello, good evening, ma'am.
Good evening, ma'am.
How are you doing today?
I'm good. And you?
I'm good. How's the family?
The family's good.
Okay. My name is Folashade Onosanya. I'm a student family nurse practitioner from Warden University, and I'll be going through a lot of questions. I want to know you. I want to familiar myself with you and you too. And I will be asking you a lot of questions concerning your health. And if you have any question, you let me know. You can ask me, and you can call me Shade. People call me Shade. So, what is your name today?
My name is Mary Onasayo.
So, what's your date of birth?
April 12, 1998.
Okay, so how old are you now?
I'm 20.
20. Okay, today, why are you here today? What's the reason you are here? What's your shift complaint?
I have some pain in my upper thigh since yesterday.
Okay, the right side or the left side? So, can you point to the place that is? So, how long has it been there?
It's been like since yesterday.
Okay, so what is the duration of the pain? Is it 2 minutes or 3 minutes?
2 to 3 minutes, yes.
Yeah. So, what is the character of the pain? Is it troubling, aching, or sharp pain?
It's aching pain.
Aching pain. Okay, thank you, Miss Mary. What aggravates the pain?
Maybe when I'm moving, or maybe if I really stress my leg
Mm-hmm.
out. Yes, that stuff hurts it even more.
Okay, sorry about that, Miss Mary. So, what measure do you take to relieve the pain?
I use the Tylenol.
Use the
Two.
Tylenol.
Yeah.
How many milligram?
2 milligrams.
No, there's no
Two tablets.
2 tablets. Okay, so you don't know if it is 500 milligram, that is 1 gram for 2 tablets, or maybe it's about 325 milligram, the low dose, or which one do you take? You don't know.
I don't
Only do
know.
two. Okay. So, do you have any medication with you now?
No.
Which medication are you taking before coming here?
I would take vitamin D
Uh-huh.
and the Tylenol for pain.
And that's all you take?
Yes.
Okay, Miss Mary. So, how often do you take that pain medication?
Only when I have aching.
How
The
many times in a day?
2 times
2 times a day.
or anytime it's really.
But you know you should not exceed 4 gram in a day, right?
Yeah.
Okay, so how severe is the pain? Let's say the pain is from 0 to 10. The 0 make it no pain at all, and 10 a lot of pain. That is severe pain. So how do you rate your pain?
I would say it's a 6.
6.
Yes.
Okay. Okay. How? What is it? You've told me what relieve the pain. What you normally do to relieve the pain? It's only the what you told me that is Tylenol you take.
Yes.
So how about any other thing apart from taking medication?
Uh, I rest.
Okay. So that give you a temporary relief.
Yes.
Okay. Thank you, Miss Mary. So we'll be moving to past medical history. So the past medical history, how are you feeling about your general health today?
I feel pretty good.
Okay, you feel pretty good. You don't have any health issue.
No.
So how about have you ever do surgery before?
No.
Have you ever been hospitalized?
No.
Do you have any diagnosis of any illness?
No.
Diabetic hypertension?
No.
How about your immunization? Is it up to date?
Yes.
So have you taken flu because we're in the flu vaccine period now. Have you taken your flu vaccine this year?
Not now. I was thinking of doing it tomorrow.
Do you take for last year?
Yes.
Okay, that's good, Miss Mary. So, how about other immunization? Have you taken them? They are all up to date. You have record to show for them.
Yes.
So, where is the record? Is it with you now, or you will pass it to my office?
I'll pass it to your office.
Okay, thank you, Miss Mary. So, do you take any medication? I know you've told me about the pain, and you take Tylenol and vitamin D. So, when you go for the checkup, did the doctor diagnose anything and place you on any medication?
You said I had some vitamin D deficiency.
So, and that's why you're taking vitamin D.
Yes.
Okay. So, have you ever taken a blood transfusion before?
Mm-hmm.
How about any any problem with any mental issue? Do you have any?
No.
So, how about you satisfied about your health?
Yes.
So, I'm glad that you satisfy Miss Mary. So, we'll be moving to personal history. So, the personal history, can you tell me more about your cultural background?
I'm African.
Okay, so which part of Africa are you from?
The West.
Is there any specific thing you want to tell me about coming from Africa?
Not really.
Not really.
It's
Okay,
not
that's
that
good.
different.
Is there any cultural terms or any taboo that you want me to be aware of concerning your health?
No.
So you don't belong to any religion,
Oh, I do. I'm
so
Christian.
you're a Christian.
Yes.
So do you eat pork? You eat everything?
Yes.
There's no problem with anything related to religion. There's no preference
No.
about religion. Okay, so okay, we'll be moving from there. Are you married now?
No.
So you are single?
Yes.
So okay. Um, how do you support yourself?
Um, I work at a coffee shop near my school.
So what do you do for a living?
I am a student in college.
Okay, that's good. So how many hours do you work in a week?
Maybe 10.
10.
Yes.
Okay, so from there, do you get support from your parents?
Yes, they send me some money for myself.
And then you complement the money. Okay,
Yes.
about your environment you live, are you okay? There's no environmental hazard, no pollution,
Mm,
so there's no problem with your environment. Okay, we'll be moving for health habit. Have you ever smoked before, Miss Mary?
no.
Have you ever taken any alcohol?
No.
How about tobacco?
No.
Have you ever, do you take illegal drugs, illicit drugs?
No.
Or have you ever taken any medication that the doctor have not prescribed for you and you know that it's illegal,
No.
like heroin, just
No.
to relieve pain?
No.
Okay, that's good, Miss Mary. What's your lifestyle like? What do you like to do? What's your hobby?
I like to read.
Oh, you like to read?
Yes.
Okay, that's good, Miss Mary. That's a good habit. Um, Tell me about your diet within 24 hours.
I try to have a balanced diet.
Mm-hmm.
I really do like having like fruits and veggies
Oh, that's
and
good.
right
What
enough
do you eat
proteins.
in the breakfast? Breakfast of yesterday.
Yes.
So what do you eat?
Um, I had some avocado with fried eggs and some salt.
And what?
Huh?
Just avocado and fried egg?
Yes, with some veggies on the side.
Okay.
And I had a tangerine too.
Oh, that's good. How about the lunch?
For lunch, I just had some spaghetti and meatballs.
Okay, so how about the dinner?
For dinner, we just had some steak with some veggies on the side, and then
Do you do exercise at all?
yes,
So how many times a week do you do exercise?
a week I try to do exercise like 60 minutes a day. That's recommended.
Okay.
So for a week that would be six. 72
Okay.
minutes.
Thank you, Miss Mary. Then, have you ever exposed to any toxic or environmental pollution?
Um,
Okay. So thank you, Miss Mary. We'll be moving to earth maintenance. So, have you ever gone for any physical before, like physical examination, like annual checkup?
yes,
So when was that? Your last physical, your last physical examination?
about a year ago.
About a year. You don't know the specific day?
No.
Okay, I'm sorry about that. But always remember, it's always good. So,
Yes.
when you went there, do they diagnose anything like diabetes or so? When do they diagnose the vitamin D deficiency?
When they
Is it last year or
yes, when they had the blood test.
yeah? So, what kind of blood test do you do? You can't remember?
No, the doctor do it.
Okay, so that's they don't tell you you have anything. Do they ask you to follow up with a blood test?
No.
Do you do self breast examination?
Yes.
So how do you do it?
Before or after my period, I feel around the breast area for
Hmm.
any lumps or bumps or
So there's no lump now.
no.
Okay, so we're moving to family history. I want to know more about your family. Tell
Mm.
me about your family.
Everyone's healthy. Um,
Your
well,
brother.
yes, I have two brothers.
Okay, and you are how many children in your family? How many? How many are they in your family?
You mean my immediate family?
Yeah.
We're five.
Okay.
Yeah,
Okay. So you are the only girl among them.
yeah.
Okay. So now, um, thank you, Miss Mary. So, did your parents do they tell you that they have any mental illness in the family?
No,
Any diabetic?
no,
Any hypertension?
no,
Any heart disease?
no,
Any stroke?
no.
So there's no mental illness in your family and stroke. Okay. So we'll be going to review of system. So today, do you have any fever,
No,
even with the pain? So do you have any problem that you want to tell me apart from that pain?
no,
So have you do you feel like you are getting so tired easily?
no,
Do you lose any weight recently?
no,
Do you have any runny nose?
no,
Have you ever vomit or having diarrhea within 24 hours?
no,
Do you feel like your body is hot or
no,
cold unnecessarily?
no.
So they never tell you you lose weight more than usual. Have you gained more weight recently? What's your weight now?
130,
130. Then what is your height?
5'4".
Okay. Thank you, Miss Mary. Many people doesn't remember. And based on your age and your height, I think you are the right. You are doing the right thing. I'm happy to hear that. So you've told me about your diet. I know you eat good. So do you have good appetite?
Yes.
Okay, you eat 3 days a week without 3 days in a 3 times a day, and you don't skip any meal.
No.
So do you fast? Being a Christian, do you fast?
On Sundays, yes.
You fast on some.
Like, we wait till after church, then we eat.
So how long is that? So you mean breakfast on Sunday? Is
Yeah.
it every Sunday?
Yeah.
So, do you have any dietary restriction?
No.
Do you take any supplement? Okay, you told me you take vitamin D.
Yes.
Okay, Miss Mary, that's good to know. Um, Now we don't have problem with all those. We'll be going through your skin and hair and nail. So I know Do you have any skin problem?
No.
Do you have, I know you have some acne. There, what are you using from the acne?
I use the prescription cream for my acne.
What prescription? Is it doctor that prescribe it? Do you know the name? And you told me you have two medication. So, is that a medication from
It's not necessarily medication, it's a face cream.
a face cream the doctor prescribe it?
Yes.
And when doctor asks you what is the medication you are taking, it's still part of your medication. You tell everything, including creams, lotion, everything,
Okay.
in as much is prescribed. Even including over-the-counter medication is still what you are taking. So do you know the name?
No.
Okay, when next you come to share for the result of your test, you can bring it and let me see if it is okay for you to take or not. Right?
Yeah.
So, for your hair, do you have any dandruff?
No.
Do you have any lice?
No.
Do you have any swelling?
No.
Do you have any surgery in between?
No.
Do you have any hair loss recently or
No.
before? Okay. Do you have any skin problem?
No.
So there's no skin issue. There's no itching. There's no dryness.
No.
Your skin are all okay.
Yes.
Okay. So your nail. Do you have any nail problem?
No.
I can see they are in regular shape and they are pink
Yeah.
and good papillary refill. So do you, for your nail, do you go to doctor for any nail cut or anything?
No.
Okay, so that's good, Miss Mary. For we're moving to your head and neck. Can you can turn your head up, down and up. There's no restriction,
No.
and there's no swelling on your leg and your neck. There's no lymph node enlargement.
No.
There's no restriction.
No.
So they've not told you that you don't have any surgery or fair. You do you have problem in remembering things
No.
or any memory problem?
No.
Okay, your neck, there's no abnormality,
No.
there's no swelling,
No.
and no doctor, they've not caught anything, no goiter problem.
No.
Okay, so that's good, Miss Mary. So we move into your eyes. Do you wear eyeglasses?
Yes.
So for what?
For our assistance.
Okay, so are you taking any eye medication?
Uh.
Eyes medication.
Only the glasses.
Okay, only the glasses. Do you have ever had eyes pain?
No.
Do you have any redness before in your eyes?
No.
Do you have any jaundice before?
No.
And can you roll? You can roll easily. You can look. There's no restriction. Okay. So that's good, Miss Mary. There's no tear. You don't have any problem with your eyes. So everything now okay. How often do you go for eyes examination?
Mostly with the physical, like as a follow up.
So you never, no, with this your glass, do you visit the ophthalmologist just for any checkup?
Not really
Okay,
that much.
all right. I will see if you need it now. So from your we move. You don't have any double vision.
No.
You can recognize color. What color of clothes do I wear?
Uh, Navy blue.
Okay, so that's good. So what color of clothes do you wear now?
Pink and lightish yellowish brown.
Okay, that's good. You don't have color blindness. That's good, Miss Mary. Um, there's no trauma. You never have history of trauma in your eyes.
No.
No surgery in your eyes before.
No.
So okay, we're going from eyes to here. Sorry, are you tired, Miss Mary? Do you want to use bathroom?
No.
Yeah, okay.
Yes.
Are you comfortable?
Yes.
Okay, sorry, we'll soon finish. So your hair. So do you have hair loss?
No.
Can you hear me?
Yes.
Okay, so um Do you have any hair surgery?
No.
Any discharge?
No.
Any was?
No.
Any growth in your hair?
No.
Have you ever visited ENT doctor?
No.
Okay. Have you have problem in, like, you just, you have vertigo, you, when you just bed down, you feel like you are fainting and you are
No.
losing your balance?
No.
Okay, so now we move into the nose. Do you breathe easily?
Yes.
No shortness of breath?
No.
So there's no dripping in your, you don't have any discharge? You
No.
don't have any cold?
No.
Do you have any obstruction?
No.
Do you sneeze too much?
No.
Are you allergic to anything?
No.
So I want to ask about your allergy. Do you have any allergy to drugs?
No.
To food?
No.
Okay, that's good, Miss Mary. So do you have ever had any nasal bleeding?
No.
Okay, that's good. We moved from your, from the nose, we moved to your throat. So have you ever have any dental surgery?
No.
Do you have any growth in your mouth?
No.
Do you have any bleeding?
No.
Do you have any gum bleeding or
No.
any ulcer?
No.
Do you have any toothache?
No.
Did anybody, do you use artificial teeth?
No.
So there's no artificial hard palate or anything there.
No.
So you're okay?
Yes.
Any missing teeth?
No.
Say no. Okay. So we're moving from that to gastrointestinal. So in gastrointestinal, do you have indigestion problem?
No.
Do you have any heart problem?
No.
Do you vomit after eating or before eating
No.
or anytime vomiting?
No.
Do you have any bowel problem?
No.
Do you, when is your last bowel movement?
Yesterday.
So you have regular, do you take anything for any bowel movement like over the counter medication?
No.
So you don't have problem in going to the bathroom.
No.
And eyeball, you can pee when you want to pee without any problem.
Yeah.
Okay, thank you, Miss Mary. So we'll be moving there to lymph. So the lymph, I can see, do you have any enlargement in your lymph node
No.
or over here?
No.
No. Okay. So I'll be looking at that. I'll be palpating that later and feel it if you have any enlargement or lymph node tenderness. So we're moving to endocrine system. Do you have problem in tolerating heat or cold?
No.
Do you have any weight changes recently
No.
in the last 6 months?
No.
Do you urinate a lot?
No.
Do you have pain when you urinate?
No.
Do you urinate blood
No.
when you urinate? And do you feel there's a changes in your skin?
No.
How many, what's the size of your shoe?
Size 8 in women's.
Okay. And I bought the glove.
I'm a medium.
Medium. Okay. Thank you, Miss Mary. Now we want to talk about women and women. So when do you start your menstruation?
Sorry, when I was 10.
When you were 10.
No.
So how is your your menstruation? Is it regular or irregular? You see it every month?
Yes.
How many cycles do you have?
Um, a 30-day cycle?
Okay, have you ever treated for STD?
No.
Have you ever had gonorrhea or chlamydia?
No.
So do you ever have a problem in urinating, like frequency?
No.
So and do you feel like do you feel pain when you are doing your menses, dysmenorrhea?
Not really.
Not really. So then have you ever, you say you are not married, how many children do you have?
None.
None. So I wanted to ask if you don't do menses. Of course, Miss Mary is still young. She's 20 years old. She can never be menopausal. So, but some people doesn't do menses and they are a woman. So, but for Miss Mary, your last menstrual period is when?
Last week.
Last week.
In the
When?
middle of the
Okay.
Yeah.
So Miss Mary saw her menstrual period last week. So she is not menopausal yet. So I can't ask her menopausal history. So okay, about your breast, do you feel any pains in your breast before?
No, maybe tenderness, but no.
So you feel tenderness. When exactly do you feel this tenderness?
Before or maybe after my period.
Okay. Then when tenderness go, does it really pain you?
No,
Okay. Do you feel any lump there? You
no,
told me no before. Any discharge when you press the nipple?
no,
Okay, that's good, Miss Mary. We move into your chest and your lung. Do you have any chest problem?
no,
Have you ever had surgery in your chest?
no,
Do you have any pain in your chest?
no,
Do you cough?
no,
Do you bring out sputum sometimes?
no,
Uh, just as if you want to clear your throat?
no,
Okay, do you cough out blood
no,
before? Have you ever having night sweat?
no,
Like when you sleeping in the night, you see yourself sweating, some funny sweating. Have you ever diagnosed of tuberculosis before?
no,
Okay. Um, do you do any skin test for tuberculosis before?
no,
Okay. So do you want any test to check if you're positive for TB?
no,
Oh, you don't want any. And
no,
your working place, they don't make it compulsory for you to do TB test.
no,
Okay. All right, Miss Mary. It's always good if you can do it. Nobody can force you, but some working place they enforce it that you must do TB test. So it's always good being coming from Africa, and most people from Africa they are positive of tuberculosis. So I will give you something to read about it. So when you're ready, we can do the test for you. It's always good. So now for that we will move it to cardiovascular. Miss Mary, have you ever have any chest pain?
no,
Have you ever had palpitation?
no,
Okay, so how many pillow do you sleep with in the night?
maybe one,
So do you have any swelling in your leg?
no,
Have your face is not swollen?
no,
So none of your body is swollen on your hand?
no,
So do you have any circulation problem?
no,
Do you have any um intolerant to exercise?
no,
And when you climb the step, do you feel so tired easily?
no,
You don't feel tired easily?
no,
Okay. Then when you bend, did your head turn as if there's no blood in your brain?
no,
Okay, so that's good, Miss Mary. Um, we're going to hematology. I can see. Have you ever diagnosed of anemic before?
no,
Do you have anemic now?
no.
Or do you know what they call anemic?
Yes.
What is it?
Anemic is when you have like problems with your breathing.
No. It's when you are short of red blood cell and your eyes, when I press your conjunctiva, it will be so pale. So then mostly women that do you bleed a lot during menstrual period?
Um, fair amount? No.
Normally, normal bleeding. Okay, so some women are taking multivitamin after their period in order to prevent being anemic, and some people they easily be anemic. So if you want to read something about it or you have any question, you can ask me, right?
Mm.
So about anemia. So anemia is deficiency of red blood cell in your blood. So, and when it is short, you feel so tired easily. So you want to tell doctor anytime you just feel unnecessary tiredness, and you feel that you are pale, that you paper white. When you look at your hand, let me see your palm. If it's so white, so like that, you can know that you are anemic. Okay, so if you have any question, you let me know. So we are going to journey to urinary system. So do you ever have any painful urination,
No.
like dysuria?
No.
Do you have any pain when you pee?
No.
Do you have any low abdominal pain?
No.
Do you ever have urgency, like you feel like peeing and it's pressing you so bad?
No.
Do you ever have any frequency, like you urinate so often, maybe within 1 hour you urinate like 5 or 6 times?
No.
Uh-huh. So do you urinate a lot in the night?
No.
Do you have any blood in your urine?
No.
So when you urinate, do you feel like you are dripping
No.
and it takes longer before the urine comes out?
No.
So that's good, Miss Mary. We're moving for musculoskeletal system. So do you have any joint pain?
No.
I know that pain is not from joint, it's just your thigh.
Yes.
Okay, it's from your left thigh. So you can flex and easily extend?
Yes.
There's no problem with your muscle, you can walk, you are not. How about your gait? You can move without any stepping, like feeling like falling?
Yes.
Okay, that's good, Miss Mary. Then we move to neurogenic. So do you feel like fainting when you just suddenly want to get up from bed or sitting?
No.
You don't have any feeling of unnecessary weaknesses in your body, general weaknesses?
No.
Have you ever lost your consciousness before?
No.
How about your concentration?
No.
How about loss of coordination?
No.
Sometimes. Never happened to you.
No.
Okay, Miss Mary. So what is today's date now?
Today's date is September 21st, 2018.
Okay, that's good, Miss Mary. So your mental status, uh, do you have any problem in concentration?
No.
Do you have any problem in sleeping?
No.
How many hours do you sleep in a day?
The recommended 8 hours.
Okay, so you sleep at least comfortably 8 hours without interruption.
Yes.
So, do you have problem with your eating?
No.
Do you socialize?
Yes.
So you smile as if you socialize. So, do you drink when you socialize?
No.
Do you go out with a friend and socialize and you drink?
No.
Did any of your friends tell you that you drink more than they?
No.
So when you go out to socialize, how many bottles do you drink?
I don't drink
Okay, what do you drink?
juice.
Only juice.
Yes.
What kind of juice?
Any juice. Maybe some soda, but not that much.
Not that much. That's great, Miss Mary. I'm happy to hear that. How about your mood? Do you feel happy or somehow you don't feel like you're happy?
No.
Is there any time you ever think of taking your life?
No.
Have you ever think of ending it like that?
No.
Okay, Miss Mary, that is the end of the interview. So now, do you have any question?
No.
You are satisfied with everything
Yes.
and you are comfortable.
Yes.
So, in the absence of no question, so I want to thank you, Miss Mary, for being there today and for your patience. Thank you for being here today. And I'm so glad to see you in my clinic. I hope you come back again, and thank you for everything.